This is the oral case report on Harvey Simmons, played by Lana Musa for the group project. Based on the intake notes and case note written by me based on his behavior. Harvey is a 29-year-old single male who was sent for a mental health evaluation after he got into some work trouble. He came in about 3 days ago at 10:30 a.m. for an appointment that was referred to by his current employer, Matthew Porter. He is fluent in English. He has very limited family connection, only appears to have any sort of strong connection with his sister. His education was graduating with a high school diploma and EMT training, as well as receiving his NREMT certificate from the state. He's employed by the city's emergency services. He has been for the past 5 years, and he claims to have no illicit substance use or abuse in his history. The presenting issue, as stated before by his employer, Matthew Porter, says that he had an issue about 2 weeks ago at work where he got into a fight with a coworker after someone accidentally set off a loud alarm. He became very upset, shouted, and pushed his coworker in response to this alarm. In turn, his employer took him off duty while they looked into what happened, and he started receiving counseling from a work-related counselor. The length of time with this issue is undetermined. He experienced the stimulating issue about a year ago. However, this is the first time it has been brought to his employer's attention within the last 2 weeks. So the length is between a year and the last 2 weeks. He is a white male. He says he is affiliated with the Protestant denomination and attends church as often as he can with a demanding job that he has for his cultural identities. His boss said that he had some strengths with his ability to handle stress well under pressure previous to the issue. He was always timely and dependable. When they needed him, he was there. Until the issue occurred, then his performance has been declining in the last 2 weeks. Based on the mental health evaluation, my tentative diagnosis is that based on his symptoms of worrying, emotional numbness, response to the crisis at hand, and his reported nightmares and sleep disruptions due to the trauma that he experienced with the death of a child in the field, I would say that he is experiencing post-traumatic stress disorder symptoms and generalized anxiety disorder symptoms. Based on these few symptoms and diagnosis that I was presented with during the case. As far as medication goes, he says he is not willing to take medication at the moment, and he has denied it at least once now. However, he did say that he was willing to try therapy aside from the counseling that he is receiving at work. What case management services would I provide to the client? As far as Harvey's case goes, I would say that he should be meeting with a therapist at least 1 to 2 times a week until results improve or his feelings begin to decrease. Then we can move on with possibly once a week or maybe once every 2 weeks if symptoms decrease. I will meet with him on this case once every 2 weeks for now, as he receives therapy to give time for desired results. If the client begins to express suicidal or homicidal thoughts, I will help him by increasing surveillance on him. I would contact his sister, since that appears to be the only family member he has any sort of contact with or strong relationship with in general, seeing if she is able to check on him at home. And I would ask the employers to increase surveillance at work as long as he goes back on duty, especially in the field, just to keep an eye on the homicidal part. And then I would increase meeting times with his therapist, and I would strongly advise medication or to seek medical treatment from that point on. Overall, Harvey is experiencing quite a few specific concerns that I would say. As far as the work-related trauma with the child, his flashbacks and nightmares, his stressed out and shaky signs of anxiety, as well as difficulty concentrating, his recent altercation with his coworker, and his limited family support, as well as lack of prior mental health care. He seems to experience possible signs of general anxiety disorder and post-traumatic stress disorder. That is what I would diagnose him with as far as his behaviors go, and what Harvey said during our interview and our talking time.